Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting from the Hayburn Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m., and we also stream our show on SoundCloud. The show is a project of Kentuckians for Single-Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. The views and opinions expressed on our show are those of the speakers and not the station. Today our show is a discussion on the positions of different political parties on single payer. It will be moderated by Kay Tillow, our chairperson, so let's get started. Kay?
This is Kay Tillow. I'm with Kentuckians for Single Payer Healthcare. We are a local organization that is dedicated to advocacy for a healthcare system that will cover everyone, that will remove the profits, that will allow freedom for physicians to practice without the interference of insurance companies, and will assure that every single person in our country has the benefit of all that our healthcare system has to offer. We have a very potentially great healthcare system. We have the capability of taking care of all of our people. As a wealthy nation, we have the ability to do much better than we have been. So we've been working since 2004 to bring this issue to public attention and to work to advocate enactment of an improved Medicare for all, a national, not-for-profit, single-payer healthcare plan that would indeed cover all of our people and make sure that no one is left behind. Our slogan is everybody in, nobody out. So we are in the middle of an election campaign now with various positions of parties and candidates. And we decided that a group of us who were part of Kentuckians for Single Payer Healthcare would have a discussion about what those varying positions are, to try to elucidate what the positions are. And of course, our objective is not to get you to vote for any candidate, but to urge you and everyone to push all of the candidates and the entire political system to adopt a position that can bring us to enactment of a national health plan that will work, and that's at least a single payer system. So first, I'm going to ask that the people with me make an introduction of themselves. Would you like to start, Jill?
Okay. I'm in here because I just don't like waste of resources. Resources like taxpayers' money, physicians' time that they spend talking with insurance companies, and just our own selves. Because if we don't have healthcare prevention, then we're going to get worse and worse and worse. And that's wasting resources if you have to have an operation rather than just do preventive. And I really hate the idea that taxpayer money is being used. Our money in taxes is going to investors in the healthcare system rather than our money going into paying doctors. I hate the fact that they're depleting Medicare's funds. And, like some of conservatives complain about bureaucracy of the government. But what about the bureaucracy of insurance companies? That's
it,
really even
Jill.
worse.
Right, and that was Jill Harmer, who is a longtime activist within Kentuckians for Single Payer. Would you like to introduce yourself, Paul?
I'm Paul Hoppy, and I normally introduce these programs, but today I'm being a fully active participant. So we've been with the group several years, and I'm anxious to get started.
A good deal. And Dr. Katrina Kirfa.
Hi, I'm you can just call me Dr. Katrina. I'm a board certified family practice doctor who has served in various places in Kentucky. I served for a decade for a federally qualified community health center. I've also worked in Western Kentucky and for St. Clair Regional Hospital. I, in the early 90s, was on the National Board of Directors for Physicians for a National Health Program. And I would very much like to see the knowledge and experience of physicians who have been wanting a national health program for more than 3 decades have a voice.
And Hamza.
Hello, I'm Hamza. I'm a bit on the younger side for this organization, but I am a second-year medical student at the University of Louisville. Actually, speaking about Physicians for National Health through adjacent organizations, I was able to find this, and I'm here also to stand and fight and make some reform to a system that I'm going to get involved in later down the line.
Great. And Charlie?
I'm Charlie Casper. I've been a member of Kentuckians for Single Payer for approximately 10 or 12 years. And I'm presently a member of the steering committee. And I just think it's an insult that this country can't come up with a plan to cover everybody at a much lower cost. And we've been working on that for some time, and we'll continue to do so.
And Harriet?
I'm Harriet Seiler, and I'm with this group because I was born and raised Canadian and have a lot of relatives up there. And so I know that single payer Medicare, Canadian style Medicare for all can work, but you do have to keep the politicians out of meddling with it, meddling with the funding. However, the Canadian system is working and Canadians do love it. Like Kentucky, they too have areas that need more doctors. But apart from that, it's a good model to follow. And let's see, I've been a member of this group since I think about 2006. Anyway, before the ACA.
And Antonio?
Yes, my name is Antonio Whitcliffe. I am a member of the Kentuckians for Single Payer Healthcare. And I became involved because I was concerned about healthcare being provided for everyone and the cost of healthcare as well as prescriptions. When we, as a one of the greatest, biggest developed countries, pay more for healthcare than other developed countries than other developed countries in the world.
Mm-hmm. Thank you. And now we're going to go into a general discussion of the various candidates' position. Who would like to start? Jill.
Yeah, I'll start with Kamala Harris, who has gone back and forth on Medicare for all. And I want to read you some specific quotes. During a debate in 2019, candidates were asked who would be in favor of private healthcare insurance and eliminating it. She raised her hand. And then she said in that same year that it's okay to have insurance companies in if they abide by the strict requirements that the US government would make up. And in another town hall, she said that from what is your solution to ensure that people have access to quality health care at a fair, affordable price? She said that we need to have Medicare for all, after some hesitation though. So she has gone back and forth, and when Bernie Sanders got all these ads, just $1 million of ads against him when he came up with his proposal for Medicare for all, and she hesitated. So she didn't want that.
Okay, well, maybe we'll go through these positions of these candidates and then have general discussion on whichever part people would like to pick up on. I can present what the Trump Republican platform says about healthcare. It's fairly brief. It says, healthcare and prescription drug costs are out of control. That's true. Republicans will increase transparency, promote choice and competition, and expand access to new affordable health care and prescription drug options. We will protect Medicare and ensure seniors receive the care they need without being burdened by excessive costs. That's pretty general and pretty vague in terms of what it means. We do know that during the Trump presidency, he worked hard to repeal the Affordable Care Act, and there were many, many efforts at doing that. And in general, it is getting the government to step aside and allowing the insurance industry to do their thing. Is there a position from Jill Stein? Katrina?
Yes, I can speak to Dr. Stein's position. Like me, she's been an advocate for a single payer plan now called Medicare for All for at least 2 decades. And she, the difference between her position and Harris's position is she doesn't go back and forth. And so she calls it an improved Medicare for all, that instead of bowing to try to maintain the private insurance company profits, as Harris's maybe Medicare for all plan would do, Jill Stein seeks to eliminate the 25% of administrative waste that is currently happening in our healthcare system. She says that the fatal flaw of the Affordable Care Act was that the privatization. So our Medicare and Medicaid programs are being farmed out to private insurance company contracts, and which does not allow the administrative savings that a true Medicare for all plan would have. Physicians for a National Health Program, in studying different positions, found that the Canadian system that was mentioned earlier by one of our panelists here, it was truly the best system because it only had one, all the costs were spread by the all in, nobody out position. So basically, in a nutshell, Jill Stein is for Medicare for all, an improved Medicare for all that would save $500 billion in cutting the bloated administrative fat off the system, getting rid of the wasteful paper pushing CEO salaries, advertising. I mean, it's ridiculous to see a public health program advertised on billboards and sides of buses. We don't want our tax dollars to pay to advertise Medicaid programs. We want our tax dollars to pay for delivering health care. And that's what the Jill Stein's Medicare for All system would do.
And did you want to also explain what the libertarian position is, Katrina?
So the libertarian position is about free market competition and decreasing regulation. So the libertarians state that the government prices that they set for paying providers is set too low, and are increasing at less than the cost of inflation, while the cost of providing medical care increases. But I think they must be talking about, in that position, Medicare and Medicaid. And indeed, the payments going to providers from Medicare and Medicaid are low when the contracts are farmed out to private insurance companies. So so the libertarians when the libertarians talk about the ratcheting down on payments to providers, I'm thinking they're talking about eliminating, they're talking about Medicaid and Medicare. The other piece of it is they want to, the libertarians think that government regulation of building of medical facilities is done by a complex process of and like applying to get a medical facility built and so forth is complex, and it favors the biggest corporations and prevents smaller organizations from opening new facilities. So they want to eliminate government regulation of the building of medical facilities. They want to eliminate government expenses in terms of the length and the lengthy FDA process for making sure our medications are safe. And they believe in the right to try, like an experimental drug, which is a little bit strange to me, because while they want the right to try experimental drugs, they complain about how the somewhat experimental vaccine was forced on us because that limits freedom. And then they also talk about tort reform in the legal system. So they don't talk about, there's no position on universal coverage. They advocate for a system that would not provide universal coverage.
Okay, so we've talked about the four positions, and now I'd like to open the discussion to further delve into those positions that are among the presidential candidates that we're now in the campaign we're now working on. Who would like to speak on this? Paul?
Well, I want to mention that I couldn't help but hear that it was hard for you to read the Trump position with a straight face.
That's true, Paul.
But speaking to that, I tell people all the time that, very simply put, their administration is going to come after our Medicare and our Social Security, for that matter. They're going to come after it hard, and they're going to want to make steep cuts, which is completely the opposite of the direction that we intend to go.
Hansa?
I think a lot of times when candidates or different parties even talk about this is that, they'll lead in with a common theme that is we need to reduce cost, right? And we need to expand coverage for a lot of people, which everybody agrees upon. The devil is really on the second part of the sentence. So like Paul was mentioning, we'll keep Medicare, but the actions that they'll take while it's going on will definitely threaten insurance coverage for not only seniors, but lots of people. And I think it is also not as explicit as simply just getting rid of Medicare. If not, it'll be other ways such as privatizing, like Katrina mentioned, where we have a problem of the privatization of Medicare, and certainly that could become something that's worse. And specifically, the privatization of Medicare has not only driven up costs, but also has been a challenge for many seniors to get coverage as well, because now there's a lot more control on prior authorizations and out-of-network control.
Harriet?
Well, are we allowed to kind of agree with our colleagues who have already spoken. When Hamza just talked about privatization of Medicare, of course, to those of us who have kind of been working on this, it's Medicare Advantage. All those private all those Medicare Advantage plans that promise you absolutely everything, food and drink and dental and everything, are all run by private insurers, Humana, United Healthcare, and sometimes they have other names like WellCare, and they are profiting big time. Meanwhile, they're profiting because they have an arrangement with our tax dollars, and Jill talked about that. Our tax dollars are in the Medicare Trust Fund. And for every senior that Humana has or United Healthcare has signed up with Medicare, with a Medicare Advantage plan, they get a fixed figure, and Kay calls that, don't you call that a cap? No, a per capita amount of money. And if the insurer decides, well, we don't think maybe you need that procedure right now, they keep that money that, should have gone for care. And so not only are they holding things up, as Hamza said, with prior authorization, they're also holding things up, with prior authorization and just plain old denying the care. And so, to me, that is just it's fraud, in my opinion. And then on that topic, not on that topic, I'd also like to mention, Jill talked about the Kamala Harris position on healthcare. And the only thing I would like to add, it's true about her going back and forth, and you were good to pick up on those debate quotes, which I hadn't seen. But the one thing we need to remember about Kamala is that she has been working with Joe Biden for a long time. And Joe has been, or President Biden, has been devoted to the ACA because he was the vice president when that was passed. And he and Obama, of course, thought it was one of the most wonderful things they've ever done. And the good parts are, the best part is you couldn't be denied if you had a pre-existing condition. And the other good part was if you could stay on your parents' plan until you were 26. Oh, and the other thing that I think we often forget, and correct me if I'm wrong, but I think the expansion of Medicaid came in under the ACA.
That's true.
And so that is a good thing. So we've now got 3 things. My arthritic fingers don't go up. 3 things that were good about the ACA. But lots of people are still uninsured. And those who are buying those marketplace plans, like the silver and the gold or whatever plan, those plans have deductible, even if they're subsidized by tax dollars, they are run by private insurers. And some of them have, correct me if I'm wrong, but I'm pretty sure there are deductibles and co-pays and things like that. So let's see, was there any? Yeah, I just wanted to stress Kamala's ties to the ACA. And I'm sure she, she'll consider that as a strong position in her background. But let's urge her to build on it, and get rid of those private insurers.
And Jill, you wanted to speak? And then
Yeah, I'm thinking of what we call Medicare Disadvantage. They advertise and they say that they're going to reduce costs. and increase the quality of healthcare. Well, it's a lot easier to reduce the cost than increase the quality. And when they like have private people, private investors, they're interested in saving money. And so the reduced costs go to the private investors.
Right.
And we don't get good care in the process. So they can make these false promises and people think they can do both, and they don't.
And then Katrina and then Charlie.
So while I appreciate the good things that were mentioned about the Affordable Care Act and Obamacare, whatever you want to call it, the problem with it is that we can't afford to expand the care to everyone. So some people got a little bit better care. Some people got insured under Obamacare, but it's just unsustainable to give everybody. We can't afford to expand it to everyone. So it won't happen. And in some ways was probably actually a step backwards, making it harder for us to become disentangled from insurance companies. And so I'd just like to add a little bit about that. I mean, the free market, it doesn't make sense to have a free market in healthcare. You know, if you're hit by a car and you need an ambulance, you can't call around to see which is the best hospital to go to and at the most affordable price.
Right.
So talking about free market competition in healthcare doesn't make sense. You know, if you have free market competition on the price of medications with supply and demand, if you're on a medicine you have to be on, then it might get pretty expensive because people, you know, and anyway, I have more to say, but I wanted to at least make those 2 points.
Thank you. And Charlie.
Yeah, I think Katrina and Harriet both brought up excellent points with respect to Kamala's position. I think she's newly nominated. I think she's still feeling her way along. I think she probably uttered stuff about Medicare for All early in the previous campaign and probably got torched for it. So I think I'm hoping that there's some position there where the Medicare for All comes back on her radar screen. And once she gets out of the throes of Joe Biden and Obama, that she will develop her own thinking on the issue. And I'm very hopeful of that because I think she's a smart woman and I think she knows what she's talking about and can appreciate that. And as far as the Trump position, it's the same old thing. They have no idea what they're doing in terms of promoting something on an improved healthcare plan. So I think in many respects, that just kind of speaks for itself.
Katrina?
So I also wanted to speak to Trump because I feel for people who really believed that when he said he was going to drain the swamp, I think people really believed that he was going to get the corporate influence on our government out. And when that is not what he did. And people have to realize that he doesn't have a position that's going to help rural Kentucky or poor people in Kentucky, poor working people on healthcare.
I'd like to just throw in maybe a little bit of a historical perspective on this because many of us have been working on this for a very long time. And we are in battle with the power of the for-profit industries that control our healthcare system. That's what the fight is over. Our healthcare system costs about double what it costs in other industrialized countries. We spend about 18 or 19% of the gross domestic product. And other countries who have either a single payer system or a national health service spend approximately half of that, maybe 2/3 or half, and they have better outcomes. We come in last when this is the one that gets me, when we're judged according to whether people survive when they have conditions that are amenable to treatment. That means those who live because they had treatment, because they could, and we come in at the bottom of that. We are dead last. We are going down in terms of life expectancy. We are 4 or 5 years below the other countries. We are very bad on maternal mortality. All of the figures that account for whether you have a decent healthcare system, we're losing on, in spite of the fact that we have the ability to have the best. So for me, it's not like I want a tweak here or a tweak there. I want a system that is going to cover us. And that's what we've been fighting for. And the industry that is controlling the insurance industry, the for-profits in healthcare, are controlling the political system where we work. In other words, they have massive influence on the Congress, on the political parties, on the academic institutions, on the Center for Medicare and Medicaid Services, on all of the places, on the media, on all of the places where we work. So we see this movement where people agree with us. Our people in this country are compassionate. They really do want everyone to be covered. So we build and we build and we get majority opinion. We win some politicians, and then there's a pushback. So we saw that in 2003, Barack Obama took a position in favor of single payer healthcare. And he said, once we got majority in the Congress and we got the presidency, we would then pass it. But he changed his position when he ran for the presidency. And he backed away from that. And that's very similar to what we're seeing when Kamala Harris came out for Medicare for All and signed on to the Bernie Sanders Medicare for All bill in 2017. Then when she ran for the presidency in 2019, she changed the position and she reformed her plan into something like a Medicare Advantage plan that maintained the private insurance industry. And that's the battle that we're in. Whether we can persuade this majority opinion that really wants healthcare to put its effort into having a political impact that is stronger than what the industry has on our Congress and our presidential candidates. So it's not an easy thing, but we have to get the profits out if we're to have a healthcare system that really serves everybody. Paul and then Katrina.
Katrina says something about Trump campaign to drain the swamp, and that opens up the debate. What did he mean by that? And Katrina expressed an opinion. And my opinion was that he was going to take out all of the progressive liberal people in Congress and out of DC so he could enact those policies that he wanted to. So I think the swamp rats are still there, because that's who we're always going against, it seems, because the swamp is controlled really by big money, big pharma, the insurance industry, and that's our real battle, is to get those people, those lobbyists, that big money out of our Congress. We don't have a chance until that happens.
Katrina and then Jill.
So that's a good segue into some of the things I wanted to say, Paul. There's the question of what is the swamp? And to me, we have a uniswamp of people who are beholden to corporate interests and big money. So, and I guess so we hear politicians like Obama who are for single payer, but then they have to back down because of the corporate control of who gets elected. And that includes not only big money interests, but also the media, which is why I'm so grateful for this radio show, which is outside of corporate influence media. And you know, and then just to take a little tangent, to speak to the libertarian idea of removing regulatory agencies, as, you know, blaming them for the high costs of things, like the high costs of the FDA getting medicines approved. I think Jill Stein would say we don't need to remove the regulatory agencies. We need to remove the corporate influence on the regulatory agencies to eliminate the conflict of interest. If the research is done by the drug company making the drug, then maybe it should be questioned.
Right.
It's true.
But if the research is done by someone without a conflict of interest, I mean, and then gets conflict, that could be a whole show in and of itself. But you know, people want assurance. I mean, we need some rate, and then in terms of tort reform, you know, the legal system benefits people who can afford lawyers.
Okay, Harriet?
Well, I keep thinking of things I want to add. Tort reform, if you look into the Canadian system, you will see that they are not paying those high tort reform payments because the care, suppose someone was injured and has a lifelong an injury that would last a lifetime, all that medical care is covered. And so, yes, of course, there'll be some kind of lawsuit for negligence, that sort of thing, but it won't be these enormous amounts of money because the long-term care is being provided by Canada's Medicare system. So that's something we kind of forget about. I remember a doctor from Elizabethtown explaining all of that to me one time. I do want to butt in again about Medicaid, because I said the expansion of Medicaid was a good thing from the ACA. However, we must remember that Medicaid is, let's see, it's governed, or Medicaid patients are treated by MCOs, managed care organizations. And I was always kind of naive when I just used to think they were nonprofit. Well, of course, they're profiteers like the Medicare Advantage insurers, you know, and actually Humana now is bragging on being more involved in Medicaid, which I need to find out more about that. And then we've got the PBMs, the pharmacy benefit managers, who are the middlemen. And frankly, it's sort of cloak and dagger, I think. They're the middlemen between the big pharmaceutical companies and the drugstores. And then we've got the big corporate drugstores like CVS and Kroger and Walgreens, etc., and the small little independent pharmacies. So in Kentucky particularly, I mean, there are kind of awful things going on, and the small independent pharmacies in rural communities, for example, or in the small towns, are suffering. So, I mean, it's the profiteers throughout the system that are the great, sickness of our broken system.
And Jill?
And Paul was talking about Trump's Project 2025. And I'm just really scared about the whole thing, but that's where they really want to get Medicare Advantage as the default enrollment option for Medicaid. That really scares me.
Right.
Indeed. Hamza?
I think I want to touch on something that was brought up by multiple people in that, we are going up against large corporate influence. And so, a lot of the, I think, conservative Trump and libertarian reforms are focused on small things, right? It's like, what can we do for prescription drugs? But given the nature, and in particular, why a lot of us are involved in this fight is that there's lots of bureaucracy, which has driven up costs. And so, I want to draw a contrast between Harris and Dr. Stein in where, Medicare for all is the only option that reduces complexity. And so, while small reforms like drug reform would be okay, can we do insurance somewhere? It really is just a whole system-wide reform that needs to happen to address a lot of these problems. And so, going back and forth between Medicare, what seemed like okay in the meantime, and perhaps there's like a halfway between some policy that maybe Harris would come up with. It's really not enough until it is a full reform.
Thank you. Charlie?
I think it's also worth noting that Medicare is for all that we advocate is the only plan that has a plan for the uninsured and the underinsured. None of the other plans, which are basically nothing when it comes to that, address that. So it's all offshoots from the ACA, and it's very inadequate.
Katrina?
And just to add to that, I think that people who are well insured and may not care about the uninsured and underinsured really need to rethink things, because what the well insured are going to see under a system that maintains the administrative waste is a decline in the quality of their insurance. I think they're already seeing higher co-pays, higher out-of-pocket costs. And so there's a benefit to the well-insured to insuring everyone, not only from a public health standpoint, but also from a financial standpoint.
Yes, I remember Paul Wellstone said, we all do better when we all do better. And it's really, really true. One of the things that is happening in our country is this private control of the infrastructure of our system, and the dependence of hospitals on this insurance system that isn't working means that our rural hospitals are closing. That's really important for Kentucky and many, many other places, that the insurance industry is not sustaining the infrastructure to where we can use those hospitals. And in our own city, in Louisville, we saw Southwest Hospital close and multitude of hospitals open in the East End, seeking the higher insurance payments in that area. When we get single payer, all of us will be paid for at the same rate. Our care will be as valuable for the least of these as for the wealthiest. And there will be no reason for hospitals and doctors and clinics and facilities to run to the wealthy areas. We want to make it so that everybody has the opportunity for care. Paul?
I think what you just outlined is probably, in my mind, one of the greatest advantages to going to a single payer healthcare system. The equity that gives everybody in getting their health care.
Yes, that's true. Because, I see Harriet and then Jill.
Well, and I do remember when they put in really fancy plumbing in one of the East End hospitals. So it was almost like gold-plated faucets and that sort of thing. But you're right. I mean, the investors are chasing the dollars, but unfortunately, patients are not benefiting, except the very wealthy. I do want to talk a little bit about the the economics. I think it was Dr. Kirchhoff who said that the market doesn't work in healthcare. And actually, there was a Nobel, I always forget its name, but it came back to me. I'm a senior, and every now and then things do come back. The Nobel winner of the prize in economics a few years back was Joseph Stiglitz. And he got the prize for research that showed the market does not work in healthcare. And it has to do with the fact that, you know, you're the patient. There's no way you can have the information needed in the marketplace to make a good decision. I mean, all you care is that you somehow get fixed. And then does someone remember the research done not so long ago by conservative researchers? I think somebody might have even been from George Mason University, and that came out with how to prove that Medicare for All would save. Okay, you know, if I say billions, it'll be trillions, but we'll save great amounts of money over the next, if we look at it over the next 20 or 30 years.
Okay, then Jill and then Katrina.
As you said, Kay, we are all connected and we need to take care of everybody. The pandemic was the best example of that.
Right.
We can bring those diseases to the rich people as well as the people that couldn't afford it.
Yes. And Katrina?
As far as economic studies mentioned by Harriet, I can't help but mention the study that was done in Kentucky in the early 90s by Robert Brand, analyzing what a single payer plan for Kentucky would do. And Robert Brand, I guess he was an economist who was employed by the Nurses Professional Organization, analyzed the money in Kentucky. He said we could insure everybody in Kentucky, pay doctors and hospitals at the same rate. If we eliminated private health insurance and all the administrative waste, the state could save in healthcare expenditures $7 billion in the first year. And I told that to my legislator, who told me, well, we don't do things because it's the right thing to do. This is politics. And now we know that it can't be done on a state level. It really needs to be done nationally. And there's also plenty of research showing that if we eliminate the administrative burden of multiple private for-profit insurers, we could save $500 billion in the $500 billion in terms of the medical system, what's spent. And that would mean, and people like who are seeing higher copays and so forth, you know, it would be a system where there's no copays. We'd all get covered and save money at the same time. And the only way to do that is with an improved Medicare for all, not a privatized Medicare for all.
Yes, removing all the copays and deductibles so you take away the barriers to care and get people into early care. Paul?
Well, following up on what Katrina just said, Robert Brand told the state of Kentucky in what year was that? 2009, you said? But anyway, the same thing.
It was in the 90s. It was in the maybe 1994.
Okay, well, the same thing has actually been done to our Congress, and not so long ago by its own Congressional Budget Office, which showed that the single payer system would actually save money in the long run. And of course, Congress ignores their own Congressional Budget Office in favor of listening to the healthcare lobby.
Right. And I'm glad you're mentioning the lobbyists.
And Jill?
The PNHP, or Physicians for National Health Program website, just talks about the paucity of studies that have done to show that privatization increases the quality. And one of them that I'm looking at now is the percentage of.
Decreases the quality, right?
Decreases,
Right.
Right.
yeah, decreases the quality because they outsource and then they don't avoid the high mortality rates that go with that by outsourcing. So privatization, and the fact that there are only 2 studies quoted, they couldn't find many studies that have been done on it.
Okay, Katrina?
I also just want to shift gears a little bit to go back to the, well, it's not just, I was going to say corporate media, but to the political rhetoric of the 2 major parties. And I think the rhetoric is misleading. For example, Trump is calling Kamala Harris Comrade Kamala. Well, Kamala is hardly for a communist, right? And so communism gets a bad name because of the corruption of such places by political powers that were profiting from the government. And I just think people really I just wish there was some way to get the misleading rhetoric out of the media.
Right.
I don't think that happens, Katrina. I don't think it happens that way. Hamza?
I'm going to talk a little bit about where does high cost go. I think it's been mentioned a lot of time, we frame it as fraud. And there is a weird dichotomy where somehow we're spending the most money out of all of the developed countries. Yet, like you mentioned, Kay, we have the worst outcomes when it comes to child mortality, when it comes to life expectancy, and so part of the thing is really sort of devil in the details, where a lot of these corporate interests, they take the money that should be going towards delivering care. And it's somewhere in the bureaucracy, because there's not only a 3rd middleman, there's a 4th, there's a 5th. And then these insurance companies, they funnel the profits towards their CEOs as well. In a world where we have, especially in the United States, lots of uninsured people, somehow these insurance companies are still making more and more money than ever before. And unfortunately, it's sort of the incentive of them. If we assume for profit, right? Why would you want to pay for expensive healthcare? Right? Because that is a drain on the business of the insurance company. And so really just getting rid of those corporate interests is, the part of the problem is it creates that sort of fraud that drags it away from actually delivering care.
Right.
Absolutely.
Thank you. Yeah, I think we've recently seen that the Medicare Advantage plans that are the privatized part of Medicare, the government body, MedPAC, came out with a conclusion that they were being overpaid, these private companies, by $88 billion a year. And Physicians for a National Health Program said it's even greater than that if you count in all of the ways in which they cheat. It's up to $140 billion a year. And that money we're paying for as healthcare, and it's not going to healthcare. It's going into the pockets of these for-profit interests that are taking it away from everything that we want to be doing. And I think also, the Affordable Care Act, while it covered more people with Medicaid and it covered some people in the exchanges, although those programs are often not affordable and have huge deductibles, so that what has happened with the Affordable Care Act is that we have increased the number of people who nominally have health insurance but cannot afford to use it because of the high costs of copays and deductibles. And so that's not getting us anywhere. We have up to 40% of our population that delays or goes without care or a prescription drug because of the cost. And we have to remove the cost barrier so that we can get people into the care that they need. And, that's why we're struggling to move our nation to where we can pass, enact into law, and enhanced Medicare for all, a system that removes those barriers to care and allows the great knowledge in physicians and hospitals we have to actually bring that care to the population without interference by an industry that wants to make profit. Anyone else?
I also want to remind people that we sure value your suggestions and comments about what you're listening to today. And should you want to get those to us, you can go to our website at kyhealthcare.org, kyhealthcare.org, and drop us a comment line. We certainly would appreciate that.
That's great. And we'd love to hear from you. We'd love for you to participate in our organization. We are an all-volunteer organization. We have no staff, and we run on the contributions of our members. But the beautiful thing about that is it makes us free to express our opinions and to tell the truth about the healthcare system. And we believe that it's ordinary people like us and other people around the country who are going to make this happen, who are finally going to organize enough democracy in the land to push this through and to bring a health system to our people. Anyone else have some closing thoughts?
No, just thanks to everybody who, did some research on the candidates, and we need to keep looking into that.
And I was just going to close with letting you know that in spite of the fact that the industry that we fight against controls much of the media and much of the Congress, they have not persuaded the people, and that we remain about 2/3 of us in favor of an improved Medicare for all. In a poll in 2020 by the Kaiser Family Foundation, found 77% of Democrats, 61% of independents, and 24% of Republicans supported an improved Medicare for all with no copays and no deductibles. We have the people with us. Our challenge is to mobilize that force so that it's powerful enough to enact the legislation that we need. So thank you, everyone, for participating. This is Kentuckians for Single Payer Healthcare, and we're signing off on Single Payer Radio.
One more thing before we sign off. A quick plug for our WorldFest booth.
Oh, you're right.
Yes, over the weekend of August 30 through September 2, we have a booth on the Overlook on the Belvedere, and we'd love for you to join us to help us to staff that booth. We'll be functioning from noon until 8 p.m. And you can sign up on our website, where Paul Hoppy has been able to put up a form where you can volunteer. So we need help. Come to the WorldFest and participate and help us to spread the word about improved Medicare for all.